and gentlemen, welcome to Signature with Bella Gold. In today's episode, we have the honor to host a medical expert and a specialist in gynecology, no other than Dr. Jane. Dr. Jane, we're pleased to have you here.
Thank you.
No need to, ma'am.
Okay, my name is Dr. Mrs Jane Nwokeji, the CMD Healing Touch Hospital.
Thank you, ma'am. All right, Dr. Jane also has a medical outreach and community services that she renders. So, ma, could you tell us about them?
Okay, so many years ago, my parents used to do outreach in the village. They tend to help people. My father was the Igwe of my place, so every Christmas he will now give things to the poor, the widows. People will come to our house and he gives out things. So when we grew up, we continued that way in medical way. So we'll bring in medical experts. We treat people free in the village. We'll choose some hospitals where we will do surgeries for them and we'll pay for them. So we've been doing that in the village. And during COVID, my mom did an outreach which I posted in the Facebook. She gave bags of rice during COVID, over 3,000 bags of rice, free to the people during COVID. She gave onions, tomatoes, and I posted it to Facebook. She helped a lot of people during COVID. So.
Wow, thank you so much, doctor. So can you run us through your lifestyle? Who are you in school? What have you done?
Okay.
Where are you coming from? And where are you now, ma?
Thank you. I'm a married woman. I'm a mother and a medical doctor too. Okay. I'm the CMD Healing Touch Hospital, and I do free medical treatments for people once in a while because I don't have anybody sponsoring me, so I do it on my own. So that's what I do.
Okay, ma. Thank you so much, ma. Could you tell us one of the challenges women experience in health, the reproductive health?
Infertility, and they have challenges during childbirth. Those are the things women usually experience: infertility and challenges during childbirth. You know, in African setting, a lot of women believes in doing normal delivery, the Hebrew women way. And so when you tell them there are certain things doctor will say and say this baby will not come out the vagina way, that it will be CS, C-section, they will tell you God forbid that nobody in their family has delivered through CS. So those are the challenges we get from women. The infertility thing, men believes that infertility problem is a woman problem and not men problem. It's just for the women. It's caused by women, which is not true.
When you say the Hebrew way, was it really specified that the Hebrew way is that the child has to come out through the vagina?
That's their belief. It wasn't written in the Bible that way.
Okay.
They didn't tell us the root.
Okay.
They didn't tell us the root.
So whether it's the vagina or the CS,
way.
the Bible didn't specify.
Specify. Yes. All we know is that the woman must deliver mother alive, baby alive. That's the most important thing.
Okay. Okay, ma'am. So how do you help your patients with family planning?
You know, the country we are in, it's difficult already. So the country have already started telling families to plan. You don't need anybody to tell you to plan your home these days.
Sure.
So, but when they come for antenatal, we usually educate them to give birth to the number of children you'll be able to train and cater for. Don't just give birth and you won't be able to take care of them. Yes. So we train them during antenatal. We usually give talk on that. Yes.
Okay, ma'am. Could you take us through an experience you had while doing one of the outreach for the women? What exactly do you do for these women?
Okay. For the women, we usually do free surgery Yes, I just concluded last year, September. I did a free surgery for 100 women.
Oh,
Yes.
100 women.
Yes, yes.
Free.
Yes, I did free surgery for 100 women. Yes. So, and nobody sponsored me. It was done.
I'm laughing.
Yes, yes. It wasn't easy.
Oh,
yes.
so there are Africans that still believe in Africa
Yes.
and in helping humanity at
Yes.
that time.
Yes, yes.
So what was the reaction? How did they feel?
They were very, very happy. They don't believe that such thing will happen because initially when I did the advert, they were like, which government is sponsoring it? So if they come in to do registration and they find out that there is no government behind it, there is no political party behind it, they don't believe that it's going to be a reality. Some of them thought it won't work. Do you understand? So, but when they came and when the surgery started and they found out that we were doing the surgery, a lot of people were coming. A lot. The number was more than the 100 we said. If I have money, I will do more. Yes, because a lot of women needs help medically. Women and children, they are the most vulnerable. We are not saying that men are not vulnerable. The women and children are the most vulnerable. Yes.
Okay. So what's the advice for women? How do we know? What are the symptoms we need to look out for in terms of our reproductive health?
If a woman notices any changes in the system, like for instance, a woman should be able to be examining her breast personally. When you look at yourself in the mirror and you notice one size is bigger than the other, you look for medical advice. You seek for medical attention. Okay? You notice any lump, you seek for medical attention. If you notice any discharge, frequent vaginal discharge or bloody discharge, you seek medical attention. It's very important.
How about the herbs? They say no, rather go take herbs.
You know, the problem with herbs, we are not saying that herbs does not cure illness, but it does not have measurement. You can tell somebody now, take 1 glass of herbs. That 1 glass can be prepared with 20 leaves. Another person will make his own herbs using 100 leaves. It doesn't have dose. They don't have particular dose they will take. They can overdose it, they can underdose it. That's the problem.
Okay.
That does not mean herbs does not work. Herbs works.
Herbs works just like does not have dosage.
Yes, no dosage for it.
Okay, now can you take us through the world of children? You recently had a program for children.
Yes, we did for children. But it wasn't that much elaborate like the women zone. They are the first set of people that we did for, but just few of them came in. And when we did it and it was successful, more people started coming and we told them we've closed it.
Okay, well, what surgery was that for the children?
We did hernia surgery for them. We did hydrocelectomy for them. And some of them we did tonsillectomy, adenidectomy. So those are the major surgeries we did for them. There are some that had we did appendectomy for people that had appendicitis. So we did appendectomy for them. Yes. Yes.
Okay, ma'am. So with all of these programs, how do you manage your lifestyle? What's your daily routine like? do you really have a social life?
Yeah. I tried my best. I try to do some things for myself. You know, when I wake up in the morning, I present myself to God. My day starts with, after saying my prayers, I go to morning mass every day. I come back from morning mass and the other routine sets in.
What time is morning? When you say wake up in the morning?
No, I wake up every day by 4 o'clock.
Early.
Yes, every day by 4 o'clock. So my day starts by 4.
So how do you manage it? How do you
It's something you can use something. It's something you can program, arrange, and make sure you do the right thing at the right time. It's all about planning. You make sure your families are not lacking. The hospital is not lacking. Your personal life is not lacking. It's just about planning. You need to plan yourself. Yes.
What if one doesn't have a supportive spouse? What would have been? What would be your advice to such a one?
But I was lucky to have a supportive one. My husband is very supportive. Even the program we did, he was very, very supportive. If not, I won't be able to cope. I won't be able to cope. And I have supportive children. I give it to them. They are wonderful people, yeah.
So how do you relate it to staff?
And I have very wonderful staffs. You know, they said men behind the machine is more important than the machine itself. If my staffs are not wonderful, I won't be able to cope. I won't be able to do it alone. I have wonderful staffs. I give it to them too. They are doing great. And I don't joke with them. They know that. And they don't joke with me too. So that's what makes the team work well.
Wow, that's beautiful.
Yeah.
So what's your advice for women out there, probably yet to be married, still single, and also wants to be a doctor, a gynecologist, or also want to treat their own hearts?
You know, you have to have a dream and have a passion for that dream for it to work. You must have a dream. If you have a dream without working towards it, it will not work. And you must have the passion. So the three things must go hand in hand. So with that, you'll be able to achieve your dream. If you have a dream and you are sitting down folding hand praying only, it will not work. It will not work. So you must work towards it. You must work hard. To be a doctor is not a day job. You have to be hardworking.
Now, when you say hardworking, how do you mean hardworking?
What I mean is that for you to be a doctor, you must be an intelligent person. You must know your onions well. You must know your books well. And you must have empathy for your patient. You must have the zeal, the passion. If you don't have the passion, you won't be able to handle certain cases. You won't be able to treat certain emails. You will not. So you must have passion for it. Yes.
Have you always wanted to be a doctor because you came out from a family of doctors?
No. In my family, I was the first person to be a doctor in my family. Yes. From day one, I wanted to be a medical doctor. I have the passion for it. I wanted a situation whereby I will help the poor, treat the sick, help people to get better. And I feel so happy and so great each time I see my patients doing great. Whenever I treat them and they get better, it gives me joy. Nothing gives me joy like that. I feel so happy each time my patients are doing great.
Are you really making money? Making money?
That's the problem. I'm not.
Okay.
I'm not. It's just that I do one or two other things, and when I make the money, I use it to do the outreach I do. Like, left for me, I will want to do another one this year. If I have money, I want to do another one this year. And if I'm going to do another one this year, it will be more than 100, because last year was more than 100. The challenges I had last year was that I had the situation whereby some people that are not indigent want to claim that they don't have money to do surgery, and they were included just for us to find out later that they are well to do. You know, the main aim was to help the poor, the people that cannot afford the surgery, because we did a lot of myomectomies, we did a lot of lumpectomy, we did a lot of cysts. So we had different doctors for the surgery from different fields, helping the women out.
For free.
For free.
In Nigeria.
Yes. The surgery was free.
Okay. Oh, so those things are real. They really happen.
Yes, the surgery was free.
Okay, man. So how do you handle emergencies? There's this story out there. Nigeria, no, they are not trained. They can't handle emergencies.
Who said so? The thing with emergencies is that we have different types of emergencies. So there is no trained doctor that cannot handle emergencies. Do you understand? It's just that Nigerians, most of us don't like going to hospital until the cases are very bad before they will start coming to the hospital. If you travel abroad, you will see somebody is not sick. He will walk to the hospital for the blood workup to routinely check him or herself. But Nigerians, they won't come to hospital. Instead, they will be waiting until the case is very bad. They will rush to the hospital when the person is almost dying. And if anything goes wrong, they will tell you the doctor doesn't know what he or she is doing, which is a lie. The best doctors in the world, they are Nigerian doctors. The best gynecologists in the world are Nigerian doctors. The best physicians outside there are Nigerian doctors. The best surgeons are Nigerian doctors. So what are we saying? And 90% of them trained in this our country. So if they can do it there, they can equally do it here.
Okay, now some of them say it's because the hospitals are expensive. Registering and consultation fee. And
That's where government needs to come in. They need to subsidize a lot of things. Insurance needs to come in. People should register under HMOs. Do you understand? They have health care facilities, insurance, healthcare insurance. They can register.
As a family, as an individual, how do you register?
You can go online,
Okay.
choose the one you want,
Okay.
and see the one you can be able to afford. We'll have so many of them. You register under them.
So I go online and I see.
You
an
search,
HMO, I
yes,
search,
yes,
and I find one.
yes.
Then I
They
register.
usually have their contacts.
Okay.
You give a call to them, check for the one you'll be able to pay for,
Okay.
and go on with the registration.
Then afterwards,
You start using hospital. You can walk in and choose any hospital you want, because they do roaming. Roaming means you can walk into any hospital if you have emergency. Any hospital that have that HMO,
okay.
and start using that hospital.
So does the HMO cover the family or just an individual?
Depending on the package you registered.
Okay.
Depending on the package you register.
So-
If you register for package that will cover for 4, it can be you, your husband, and 2 kids. If you register for package for 1, which means only you. It depends on what you registered for.
Okay, so with the HMO, I can come in every month for my routine check.
Yes. There are HMOs that guarantee routine checks once every 6 months. There are some that is once every year. There are some that is once every 3 months, depending on the level you've chosen to pay for. And they are not expensive. They are not. There are some family package that is 100,000 for 6 people for the whole year. There are some that are not up to that for 6 people for the whole year. So it's affordable. It's affordable. So Nigerians should try and be going to doctors go to hospital, see doctors, stop patronizing quacks. I did a program on quackery with NTA. So I told them that Nigerians should stop patronizing quacks and go to hospitals. Go to registered hospital that have in Lagos. Registered hospital have FEMA logos. You will see FEMA logos there. You know that hospital is registered.
Okay, so what's your general advice to women in terms of their
Health.
health?
They should always go for regular checkup. Whether you are sick or not, go for regular checkup. You might not know what they will be able to say or dictate.
And that's the fear. There's this adage that says, what you don't know will not kill you.
It's a lie.
Okay.
It's a lie. If you don't know that lion is over there and you get there and see a lion, it can kill you. You just get prepared by going for regular checkup. Do you understand?
Okay.
It's very necessary to go for regular checkup, yes.
Oh, thank you so much, man.
You're welcome.
Well, how do you feel in the surgery room? Like tearing up patients in all of the surgery?
That's the passion, I said. Once you have the passion, you can do it. And knowing in your heart that you are doing it to save a life. Anything, you are doing it to save a life. And you're always happy and feel very happy when you come out from the surgical room and see your patient walk out healthy and alive. You feel happy and proud of yourself.
Wow.
Yes.
Okay, doctor.
You feel fulfilled.
Wow, okay. Yes, we asked of a story. Give us a story. One of the outreach, the feedback. How did it feel? One story.
There is one who had she came in with I think the blood level was just 8%. So we had to transfuse her. We first of all gave her I think 5 pints of blood initially to build her up before taking her to the theater. And then after the surgery, we had to give her more pints of blood.
She didn't know, she didn't realize it was
She knows. She was even having heart failure, anemic heart failure when she came in. She was having anemic heart failure when she came in. And so we had to build her up. She stayed longer before the surgery. We had to build her up and it was free. Free. She took, I think, total of 10 pints of blood. And it was free.
So what's been the challenges so far? Any ugly story like, okay, you tried to do something, but you wanted to do something, but you just couldn't do that thing?
It's just financial constraint. That's just the problem. Because a lot of people came when we started. Initially they were not turning up much, but in the middle of it, we had more than the number we wanted to do, because we wanted to do for 100 women, and we had over 180.
180.
Yes. So, and those people, we needed to attend to them, but financial constraint, because I was doing it from my pocket. Nobody was sponsoring it. I was doing it all alone. So, left for me, I would have loved to go ahead to help the other people, but I didn't have money to continue. And I was feeling bad about it. I was feeling bad because there was a case we had. The girl is 26 years old. She has a very massive fibroid of around 38 weeks size of pregnancy, 39 weeks size of pregnancy. And she said she went to the first place she went in VI. They told her they would remove the womb, do total hysterectomy for her. They would do hysterectomy for her. But she didn't have the money for that. So, but when she came, she was among the last people that came. I felt so bad that I didn't have money. For you to do that with that kind of massive fibroid, we would need to have so many pints of blood, because her she was having 13%. Her blood level was 13% when she came. So for that, you need to prepare very well. And I didn't have more money to go ahead and help her. So if I should do another one, I think she might be among the people I will call first.
What's the root cause of fibroid?
It's hormonal. It's hormonal. It's caused by estrogen hormone.
Can it be controlled? It's something that can be controlled.
But you can control it through the diet, things you eat. Eat more fruits and vegetables. It will help your system. More of fruits, vegetable will help you, instead of all these canned foods.
Thank you, doctor.
You're welcome.
It's been an amazing time with you.
Thank you.
So, as a CMD, what will be your signature color of food and why?
Okay, my signature color is white
Okay.
because white means purity. Okay, so I like beautiful things, pure things. So that's my signature color, white.
White.
I like white. My signature food. I like swallow a lot.
As an African.
Yeah.
Okay, now why swallow?
That's my favorite.
But it's heavy.
It doesn't make it. You can eat different things in form of swallow. It must not be
Okay.
fufu. It can be amala.
Okay.
It can be anything, but it can be in form of swallow. It can be unripe plantain. You make it in form of swallow. It's a very healthy food. Just to make sure you take enough soup, which is the vegetable.
The vegetable.
Yes.
Alright, doctor. Thanks so much.
You're welcome.
It was really nice having you today.
Thank you. You're
Thank
welcome.
you, ma'am. Okay, all right, that was a wonderful time with Dr. Jane, the CMD of Healing Touch Hospital. Thank you for watching. Bye bye.